Are you confident your Achilles tendon is strong enough for your next workout? Or has years of silent wear already set you up for a tear?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today you'll learn why Achilles tendon injuries are climbing, what raises your personal risk, how certain drugs change tendon biology within weeks, and what you can do now to reinforce collagen before pain shows up.
I'm Alara Sky. We'll keep this focused and practical. The Achilles is your longest, strongest tendon, linking calf to heel and allowing you to walk, run, and jump. It can handle forces up to 4 times your body weight. Yet national data from 2001 to 2020 show ruptures rising about 3% per year and now representing the most common tendon injury in emergency departments.
Men carry far higher risk than women, roughly a 5-to-1 ratio by incidence, and Black patients show the highest overall rates among racial groups. The key point is that this trend spans athletes and non-athletes. If you wait for pain as your early warning, you're already late. Degeneration often develops quietly over years.
Those numbers reflect how risk accumulates. Rupture is rarely random. Repeated overload plus biological weakening sets the stage. Abrupt training spikes, like a sudden jump in running volume, intensity, or explosive movements, stress collagen faster than it can remodel. Abnormal foot alignment, limited ankle mobility, and poor force distribution focus strain into vulnerable tendon zones.
Metabolic health matters as well. Obesity, insulin resistance, and chronic inflammation impair repair capacity and slow nutrient delivery, so microdamage piles up. The mid-portion of the Achilles has limited blood supply, making recovery slower. Underload, hypoxia, and metabolic stress drive disorganization of collagen fibers and reduce tensile strength.
Medications are a major, modifiable driver. Fluoroquinolone antibiotics and corticosteroids directly weaken tendon collagen. Registry data comparing fluoroquinolones with amoxicillin found Achilles injury risk rose 3.6-fold within 60 days of exposure, remained 2.74-fold at 90 days, and was still 1.49-fold at 1 year. Higher cumulative doses raised risk further, and recent oral glucocorticoid use stacked additional risk. Other drugs flagged as contributors include statins, aromatase inhibitors, anabolic steroids, isotretinoin, renin-angiotensin system drugs, thiazide diuretics, calcium channel blockers, and broad antimicrobial classes.
This helps explain why prevention fails when you rely on symptoms. By the time you feel stiffness or a twinge, collagen has already lost organization, and enzymes that break down connective tissue are more active. Oxidative stress inside tendon cells rises, healing slows, and everyday loads can finish what long-term degeneration started.
You can act before that happens. First, manage training progression. Increase volume and intensity gradually and schedule adequate rest. Heavy sessions need recovery windows long enough for collagen to adapt. If you're 35 to 50, an age range highlighted in recent reporting as especially vulnerable, respect these progressions even more.
Second, address mechanics. Limited ankle dorsiflexion, rigid calves, or faulty foot alignment funnel stress into the tendon. Supportive footwear is part of the fix. Evidence shows high-top shoes reduce Achilles tension compared with low tops, and shoes that bias a forefoot landing can improve tendon loading and help you progress toward more advanced movement safely.
Third, protect metabolic capacity. Reducing vegetable oil consumption is central because excessive linoleic acid undermines metabolic health and energy production. Keep total LA below 2 grams per day by avoiding oils such as soybean, cottonseed, and safflower, and steer clear of ultra-processed foods that hide these fats. Replace them with fats. The article names explicitly coconut oil, grass-fed tallow, or ghee.
Fourth, scrutinize medications. If you're offered a fluoroquinolone or a course of corticosteroids, ask about alternatives and timing, especially if you're training or returning to sport. The early post-exposure window is when risk spikes, and stacking prescriptions compounds it. The article's guidance also emphasizes avoiding antibiotics where possible and appropriate.
Fifth, build collagen from the inside out. Collagen is the tendon's structural backbone. The article recommends that about 1/3 of your daily protein come from collagen sources. Bone broth made from organic, grass-fed bones is highlighted as the best source, and gelatinous cuts. Beef shank, cheek, oxtail, pork hock or shank, leg of lamb, chicken gizzards supply the specific amino acids you need. Slow cooking or pressure cooking makes these easier to eat.
It's important to note that red meat-dominant protein alone doesn't supply the optimal amino acid pattern for tendon synthesis, and high amounts of certain amino acids from red meat can promote inflammation and suppress thyroid function according to the article's discussion. Collagen-rich foods balance that profile so you can maintain tendon integrity while meeting protein needs.
Let's connect these strategies to everyday choices. If you're ramping back into court sports, set a 4 to 6 week progression where you increase plyometric volume slowly and insert full rest days. Pair this with supportive shoes and mobility work for the ankle and calf. Meanwhile, clear seed oils from your kitchen, shift to coconut oil or ghee, and start a daily mug of homemade bone broth.
If you recently took a fluoroquinolone, treat the next 60 to 90 days as a higher risk period. Avoid abrupt load spikes, audit other medications, especially oral steroids, and double down on sleep and recovery. Quiet weeks now are insurance against months lost to a rupture later.
Footwear choices carry outsized leverage. For field or court play, a high-top design lowers Achilles tension. For running and return to jump progressions, a shoe that encourages gentle forefoot landing can improve loading patterns before you add more advanced drills. Small equipment changes shift forces away from fragile tendon segments.
Your goal is to make the tendon resilient before it complains. Gradual training, planned rest, supportive shoes, better mechanics, strong metabolic health with low linoleic acid intake, and consistent collagen nutrition work together. None of these require waiting for an MRI or a pain flare. Each is completely actionable today.
Before we close, remember what the trend data imply. Rising rupture rates reflect system-level pressures, not just bad luck. You can shift those pressures. When you lower metabolic strain, avoid tendon-toxic drug combinations, and strengthen collagen consistently, you reduce the odds that a routine step turns into a year-long rehab.
Here's your challenge. Over the next 7 days, remove seed oils from your meals. Add 1 daily serving of bone broth or a gelatin-rich cut, and redesign your workouts with a written, gradual progression, plus at least 1 full rest day between heavy leg sessions. Audit your medications and discuss alternatives if you're in a high-risk window. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.